I'm here to talk to you about health and social care. So, before I talk to you about health and social care, I just want to talk to you about success. So, it's important that you feel like you're going to become successful within the options which you choose when you decide if you come into Elaine's Academy. So, in relation to health and social care, we like to make sure that the lessons are well planned and they're organised and they're interesting for you, so you're interested in those lessons. We also like to ensure that we're celebrating the success of the students who choose health and social care. And we also make sure that we're able to ensure they are successful. So we do this through revision lessons and also coursework clinics, which will both happen after school. We also aim to ensure that we build positive relationships with the students, and we hope to ensure that we can share the success with them. And we also aim to develop links with parents in order to support any students that may need it. So the benefits of coming to a sixth form is that because they're a lot smaller than colleges, you're going to be able to get to know your teachers a lot better and build a better relationship with them. So in relation to you when you're deciding which options to choose for when you come to sixth form, it's important that you as a student are picking the course which suits you. So hopefully when I'm talking to you today about health and social care, you'll be able to gain an understanding about if you think health and social care will be the right subject for you. So within this faculty, we do A-levels of psychology, sociology and RE, but then we also do applied generals such as applied psychology and health and social care. So the main difference between an A-level and applied general is that for an applied general, there's the assessment style with that. So what that basically means is you will have coursework to complete, whereas in A-levels, you don't get coursework. So applied generals also tend to be more work related. So it gives you the understanding of what it might be like to work within the health and social care setting, to understand the different jobs. And it also means that within the lessons themselves, you're given a scenario and you'll be expected to apply your knowledge and understanding to that scenario in order to demonstrate what you have learned. So in health and social care, it's basically a course which is designed to allow students to gain a knowledge and understanding about success within a health and social care setting. And it's going to also allow them either the option to go into a job within that setting or to go into a career potentially in higher education. So in health and social care, we obviously assess you through coursework, but we also assess you through an exam as well. So there's a combination of the two. So the sort of person who we're looking for when choosing health and social care is someone who's going to be interested in working in the health and social care sector, because a lot of the course is to do with health and social care and what different roles, different job positions are available. It's got to be someone who's going to enjoy coursework, because there's a lot of coursework with health and social care. So you need to be someone who's going to be organised, you're going to be able to meet deadlines. And you also, however, don't need to have done health and social care at the lower down the school in order to pick it as an option. So if you haven't done health and social care before, it doesn't necessarily mean that you can't pick health and social care. So the skills which you gain from picking health and social care is there's a wide variety. So it's going to give you lots of knowledge into different aspects of work within the field. You're going to be able to gain organisation skills to be able to meet your deadlines. You're going to complete your own research and be able to solve problems or gain an understanding of problems that might happen within a health and social care setting. And it's going to allow you to gain experience of what it might be like to work within the health and social care setting. So the course is basically split into 4 units, and 3 of these are mandatory. So you sit the Human Lifespan Development exam in Year 12, and then you'll complete a piece of coursework in Year 12. Then Year 13, we've got Working in Health and Social Care exam, and then you'll complete a second piece of coursework in Year 13. Now, at the moment, in Year 13, the course at which we're completing is Psychological Perspectives, but this is because the students that are in health and social care at the moment, a lot of them have chosen psychology as one of their other options. So they've got knowledge and understanding within this topic. So we've chosen this as a option for them because it allows them to use their strengths and the knowledge that they've already got, and therefore it'll make it easier for them when completing the coursework. So what basically happens is you'll have one teacher for the exam, one teacher for the coursework side. And the exam, so there's one exam at the end of Year 12, one exam at the end of Year 13, and then the coursework you do throughout Year 12 and Year 13. So it's basically for the coursework, you'll get given a task or a scenario, and then you'll have to apply your knowledge and your understanding to the task or the scenario. and use your knowledge from the lessons to be able to answer any questions or surrounding that scenario. So for the content in the exam, so for the human lifespan development, it's a lot again to do with the PIEs, which we cover a lot in lower school. So it's the physical, intellectual, emotional and social development. We also gain a lot of understanding about through the different life stages, so how this development happens, but we do go into it in a bit more detail. So for example, when we're looking at language development, we'll consider different psychologists who've looked into it. So we've got Chomsky and Piaget. And then, for example, when we're looking at life events and this impact of this, we'll look at Holmes and Ray, who researched into life events and the impact that life events can have on our health. For the working in health and social care exam, this is when you'll gain an understanding of different policies within health and social care, and you'll gain insight into what policies you might need in health and social care settings, how they apply. You look at the importance of the care values, so like safeguarding, what is safeguarding, why is it important? Also considering different things like dignity, what is dignity and how can you make sure if you're with a patient, how can you ensure that they keep their dignity? And different things like that. But then it's also looking at different policies and practices within health and social care. So it might be, for example, whistleblowing. So understanding what whistleblowing is, why that might happen within a health and social care environment. So why pick health and social care? So health and social care is a fantastic option for you if you're potentially considering a job within a health and social care setting, because it's going to give you the skills and the knowledge to be able to gain an understanding of what it might be like to have one of those jobs. So for example, if you're thinking about becoming a radiographer, or if you're thinking about going into midwifery, you can use this knowledge and understanding from health and social care to think about getting a job within one of those departments. But it also allows you to potentially go on to higher education if that's what you're thinking about doing. So it can be a case of maybe if you're thinking about doing like a nursing degree or social work, health and social care is going to give you the skills and the basic understanding for those types of degrees. But it also, because we're looking into different jobs, it'll allow you to gain a bit of an insight into what you actually think that you might want to do with your future. So in relation to health and social care, we do attempt to go on some trips. So we've been on a trip to the NHS Career Fair before, which allowed the students to gain more insight, if you like, into different jobs within the NHS, and also allowed them to gain an understanding of how to get to be one of the jobs that they were maybe thinking about. We've had guest speakers in before who've spoke about their development and how that's in fact impacted them and things like that. So thank you for taking your time out to listen to me today. I'm hoping that I've given you a quick summary of what health and social care subject is like, some of the content, and obviously highlighting to you the difference with health and social care. So as it is a coursework subject, this is something to bear in mind. So if you're someone who doesn't mind completing coursework, doesn't mind sticking to deadlines, then health and social care is going to be the course for you. If you do have any further questions, you're able to email me, or you're more than welcome to come and find me in school. You can ask me any questions about health and social care. That's absolutely fine. Or you can speak to anyone else who's in the social sciences department. But thank you for taking your time out to listen to me today. And if you do have any questions, please contact me. Thank you. Bye.